It's time to take 5. Now you know.
We are here at Palm Beach Gardens Medical Center, a Palm Beach Health Network hospital. Today we're speaking with orthopedic surgeon Dr. Chadwick Hampton about robotic-assisted knee replacement and the importance of not delaying medical care. Dr. Hampton, you're an orthopedic surgeon with a specialty in minimally invasive knee replacement surgery. Tell us about the types of conditions you treat.
I treat all conditions of the hip and knee, preservation and reconstruction. That includes osteoarthritis, rheumatoid arthritis, post-traumatic arthropathies, and meniscal and cartilage damage. I'm also board fellowship trained in hip and knee replacement.
Palm Beach Gardens Medical Center was the first hospital in the state of Florida to offer Navio robotic-assisted total and partial knee replacement. Can you tell us a little bit more about these procedures and what are the benefits?
It is a platform that uses robotic assistance to aid the surgeon in performing partial and total knee replacement, causing less soft tissue damage to the patient, less blood loss. The studies clearly show a fast recovery in the first 6 to 8 weeks.
What advice do you have for patients who may have pain or discomfort but are delaying care out of fear of coming to the hospital?
We've taken many measures to ensure safety during this COVID time, and also the CDC and the American Board of Orthopaedic Surgeons has come up with specific guidelines that we are currently following.
Why should a patient choose Palm Beach Gardens Medical for a total joint replacement?
We provide a comprehensive totality of care from the beginning to end, and we also currently have the latest and greatest technology, which is the Navio robot.
Why is it important, especially now, for patients to take care of their health? And what are the consequences of putting off an elective surgery?
If a patient is indicated for knee replacement and they're at the level of dysfunction that is requiring them to take opioid medications daily, I'd recommend proceeding with surgery and not delaying, because you may create another problem with opioid dependence.
Palm Beach Gardens Medical Center offers a pre-operative orthopedic class for patients scheduled for surgery. Can you share with us why this is helpful?
If the patient is properly educated, they know what to expect going in from the beginning to the end of the procedures, the expectations in terms of pain management, post-operative care, and rehabilitative care. All this is provided at what we call the joint boot camp, or the joint comprehensive class.
The hospital has a dedicated orthopedic service line director who is also a certified orthopedic nurse, and she helps guide the patients through a comprehensive orthopedic program to ensure a patient's care is efficient, compassionate, and individualized. What are some of the things that she assists with?
She routinely goes through basically a checklist, and we go down making sure that the patient has been cleared for surgery, has gotten all their preoperative medications, has gotten all their preoperative DME, which is durable medical equipment, which could include a cane or a walker, and is scheduled for the plan post-operatively. Are we going to decide to go to rehab, inpatient, or are we going to go to home and have care come to the house?
Tell us about the safety measures that the hospital has in place to keep patients safe.
We've implemented multiple safety measures during this current pandemic. We enhanced our sanitation, temperature checks for all persons coming in and out of the facility, COVID screening for all patients that are obtaining elective surgery. We're following all the CDC guidelines, and we have separate units for COVID-19 positive patients and all other patients currently hospitalized.
Patients are allowed and encouraged to have one support person when having an elective surgery. How important is this for the patients?
This is very important. During the initial stages, phase 1 of resuming elective surgery, patients were not allowed to have a family member or a compadre with them, and it was frightening for them in terms of the unknown. That has changed. We now are actually limiting access, but one family member or compatriot is allowed to be available and to provide support.
Thank you, Dr. Hampton, for all of this helpful information. We hope everyone understands it is important to take care of your health. And if you need surgery, please don't hesitate to go to the hospital. The doctors, nurses, and staff at Palm Beach Gardens Medical Center are there to keep you healthy and safe.